Okay, I know that you hit step one, and me too. I hit step one. All of us hit step one. But okay, let's see that. Remember that blue color. To remember what? To remember the blue eyes of that disease, Osteogenesis Imperfecta. Okay. Okay. See, we have collagen. I will show you the name of it comes from where, but this is not for the step. It's just to understand this. Colla in Latin, it is a glue, okay, and gen is a producing. So this is the molecule that will glue the tissue with each other, okay, and this will be used as a connective tissue. It will connect the cells with each other. And remember that the cell that secretes that molecule is a fibroblast, because collagen is a fiber, okay, and this cell is so active, so it's called here, it's a blast. You know that this is activity, it means that's active, so it's called fibroblast. Okay, just to understand the name, okay, fibroblast, these cells, okay. To remember that they found this collagen in the host subcutaneous tissue, and they produce from it the glue as a manufacturing. All of this will not show up on your exam day, but just to understand. So see what you will see on your exam day and concentrate with me, please. Okay, with a different color, with a different color. Okay, this one. See that? It is the most abundant protein in the human body. Okay. It has about 430 types or more than that. For about 30 types. Extensively modified by this is very important with post-translational modification. Do you remember that you have that gene that contains the gene, okay, the DNA that contains that gene, and it will be transcribed to mRNA, okay, and this mRNA will be translated in that ribosome that will gives you that protein, okay, and after that you will have modification. Do you remember of endoplasmic reticulum? You remember of endoplasmic reticulum? Okay. Do you remember Golgi apparatus? Do you remember that rough endoplasmic reticulum? You will add on asparagine, nitrogen, that sugar, and here on OH or O, do you remember that we add, and or N, that we add sugar on that? Do you remember that? Do you remember that? Okay. Okay. So this is a post-translational modification, and we will see that in collagen in just a minute. Okay. Here we organize and strengthen extracellular matrix. Okay, as I told you, for the connective tissue, types 1 to types 4 are the most common types in humans. We have type 1, we have type 2, and we have type 3 and type 4, and we will associate all of these information together to gain them in our brain for the step day for the exam. Okay, let's see that we have type 1, type 2, type 3, and type 4. When that mnemonic is called the scab. Type 1, it will be found in the skeleton. You will find that in the bone. To remember, 1 is bone, and 1, O-N-E. And you will find also in the tendon, not that E, but we put it for the mnemonic to tendon of that. So you will find it in the bone, and that will attach to it. The muscle that will have that tendon that will attach to that bone. So you will find collagen type 1. And collagen type 1 is the most common type of collagens. This is the most type 1. To remember, it's number 1, so it is the most common. Okay, it's about 90% of all types of collagen in the body. Bone here is made by osteoblast, not here fibroblast, but here by osteoblast. Okay, do you remember that osteoblast build the bone, and osteoclast crushes the bone, and we will see the difference between them on musculoskeletal section. Okay, we have collagen type 1 in skin, and in tendon, and we have that in dentine, that in the teeth. Okay, you will find that in the fascia. Do you remember the fascia that cover the muscle and separate here their muscles, separate between them? It's the fascia. Okay, we find that in the cornea. Okay, we find that in the cornea in the eye. We find that this is here the cornea. Okay, it's in front of that. Okay, and you will find it will be linear to allow the light to flow through it to reach the retina for you to see that picture outside of your eye. Okay, and this is very important. I want you to remember it and highlight it. Will be found in late wound repair, and we will see wound repair on pathology section, so associate this with this. Okay, okay, unlike type 3 collagen, you will find it in early wound repair. Okay, to remember it, collagen type 1 is stronger than collagen type 3, but for the mnemonic, this is for the concept, but for the mnemonic, to remember that type 1, or the most important one, comes late because he is an arrogant person and he will not come early, he will come late. So remember that type 1 will come late, okay, and type 3 here for early. Okay, okay. Here, if you have a decrease in production, you will see that in Osteogenesis Imperfecta type 1, and we will see that. We will see that. We will see that. Okay, for type 2, remember 2 cartilage or the cartilage. Okay, to remember this is the bone and here is the cartilage. For cartilage, you will find type 2, including hyaline cartilages. We have 3 types of cartilage. We have hyaline, we have fiber cartilage, and we have elastic cartilage. Here, cartilage that includes hyaline, we will find collagen type 2 here. And this is the vitreous body here, that in the posterior part of the eye. Okay, this is the body, it's called the glassy body. Okay, the glass is called the vitreous body here. Okay, okay, you will find collagen type 2. But in the cornea, you will find type 1. Okay, to remember, C before V. Okay, C before V, so 1 here before 2. Okay, this is very important. This is the nucleus pulposus. Okay, for that vertebral column, you'll find that the outside or the periphery is called, this is very tense and hard, it's called annulus fibrosus. But inside, you'll find that jelly-like material is called the nucleus pulposus. And to remember that nucleus is in the center. Okay, but annulus, like annular, like that moon, okay, this is annular, it will be outside. Okay, but for nucleus pulposus, you will see it's type 2 collagen. Okay, okay, I may ask you a question. The type of collagen that is found in cartilage is the same as it's found in what? In cornea, or in dentine, or in early, or in late, or in vitreous body. So choose vitreous body. Associate all information. Don't study one. Study as a family. Study association. Okay. For type 3, I want you to remember that it is reticuline stain. Reticuline, I think. Reticuline, I mean. Reticuline. Reticuline, you will find that protein like in that lymph nodes. Okay. You will find that in the capsule, like in spleen, not like that. So you will have in your clinical rotation what's called the reticuline stain. Okay, don't remember that for the step, but remember that for your life. But I want you to remember that reticulin for type 3, and it will be found in skin, and it will be found in blood vessel, and this is very important, and it will be found in uterus, and it's very important, in the skin, blood vessel, and uterus, and we will associate that with a disease that's called Ehlers-Danlos syndrome. We will find type 3, and we will find type 5 with Ehlers-Danlos syndrome, and we will associate that in just a moment. And this is called the vascular type of Ehlers-Danlos. So remember V, this is a type 3 vascular, or the blood vessel. Okay, this is for type 3. For type 4, I want you to understand this This is for the basement membrane or the basal lamina. What is that? What is that? I will show you that. I will show you that you will find that epithelium here. This is the epithelial cells, right? This is the epithelial cells, right? Okay. And this is the layer that separates that epithelial cells from that connective tissue. That you will find the fibroblast, and you will find the blood vessels, and you will find the nerve and lymphatics, and you will find that collagen. Here, this is the type 4 collagen, okay, and this is found in the plasma membrane. Okay, to remember that, to understand what is that, V means 5, so 1 before V is 4, and 1 after V is 6, and 2 after V is 7, and 3 after V is 8, okay, and this is 1, this is 2, this is 3, this is the Romanian numbers, okay. So remember, type 4 is under the floor, which is called here the basement membrane, okay. If it's defective, it will be defective in Alport syndrome, and we will see Alport syndrome, and it's very high yield to know about Alport syndrome. We will see that it will affect the kidney, so you will find that in the glomerulus, okay, that's found in the kidney, okay. We will see that in histology, we will see that in histology, okay, and you will find that in cochlea, and cochlea that you will hear, it will aid your hearing, so that Alport syndrome had a problem with the kidney and had a problem in hearing, it will have hearing loss, and you will find that in the lens, so type 4 will be found in the lens, and we'll differentiate between corneal lens and vitreous body. If you don't understand this for now clearly, we will clarify these in CNS and the special senses. Okay, I want you to associate that defective in Alport syndrome, but it's targeted by autoantibodies in a disease this is called Goodpasture syndrome, and we will see that again with renal. It will have antibody against that basement membrane collagen type 4 in the lung, okay, and in the kidney, and we will see that this is very high yield Alport syndrome and Goodpasture, but we will see that in details in their section. So keep in mind it. Okay. We have here what's called myofibroglass. Okay, fibroblasts, I understand that they're responsible for secretion of what? Of the collagen. Okay, and here is for the scar, the collagen for the scar. Okay, okay. But why it's called myo? Because it has actin-like protein that will contract that scar and help in wound contraction, and this is a proliferative stage. We will see that in details on pathology section. But I wanted to understand and to differentiate between the 4 types of collagen. Here we are going to see the synthesis and the structure of the collagen. Okay, okay, see that. Oh, choose with me. Choose with me. Okay, this one. Here is the fibroblast. Here is the fibroblast. And here you have that nucleus. The nucleus contains what? Contains the DNA. Okay, and the DNA contains what? It contains the gene. It will be responsible to produce what? To produce the protein, the collagen. The collagen, okay. Okay, so we'll have many stages of collagen, and we'll associate the stages with what? With diseases, and this is very important for your step exam, to associate the normal with the abnormal, to associate here the pathology with the physiology. Okay, the physiology and the normal, the pathology is the disease. This is the abnormal. Okay, let's see that. We have that this is the cytoplasm, and this is the nucleus, and this is the collagen mRNA, and this is the rough endoplasmic reticulum. Here is the ribosome. With this mRNA get what? It will get translated. But why in rough endoplasmic reticulum? Because it will be secreted outside, okay, in the connective tissue, in the bone, in the tendon, in the dentine, okay, in the blood vessel wall. Okay, so it will be modified in rough endoplasmic and Golgi. Do you remember the video? Do you remember that the free ribosomes is for cytosolic, for mitochondria, for peroxisome, but here for rough endoplasmic reticulum, for outside and for lysosome. Do you remember that? Do you remember that? If you don't remember that, check it again in your book. If you don't understand it, return to the video. Okay, Here we have that nucleus. Here we have that collagen mRNAs get translated to what's called the pro-collagen. Here in the synthesis, this is the first step, which is called the pro-alpha chain backbone glycine XY. I don't understand this. I don't understand it, doc. Okay, I will show you that in a minute. Do you remember that from the primary structure or the secondary structure, tertiary structure of protein? Do you remember that you have that primary structure? This is amino acid. Do you remember that when you bend it, it's just called alpha helix? I want you to differentiate between alpha helix and alpha chain. That alpha helix is right-handed, unlike alpha chain is left-handed. Okay, so alpha chain is different from alpha helix. So this is alpha chain. This is not an alpha helix. Okay, I want you to understand again. And to differentiate that this will have this amino acid, this amino acid, this amino acid, and repeat. This amino acid, this amino acid, this amino acid, and repeat. You will have glycine, and usually you will find proline and or lysine. Okay, this is in the X position, and in the Y position you will find the proline and the lysine, but it will be hydroxylated OH. So glycine XY. So you will see in X what? You will see proline and you will see lysine, and for Y you will see hydroxyproline or hydroxylysine. Okay, usually you will find that. Okay, so collagen is third is glycine content of collagen is less variable than that of lysine and the proline. Okay, you will find the glycine and X and Y. You may find lysine or another amino acid, but here you will find the glycine. Okay, so it's the third. Okay, third. So glycine, X and Y. This is the third. Okay. This is what's called, this alpha chain is called the pre-pro-collagen. This pre-pro-collagen contains what is called the signal to enter it in the rough endoplasmic reticulum. Okay, that will direct that pre-pro-collagen, and it will be cut inside rough endoplasmic reticulum. It will be pro-collagen. So this is called the pre-pro-collagen, and this is called the pro-collagen. Okay, inside rough endoplasmic reticulum, you will have what's a very important thing. This is called hydroxylation. Remember C, hydroxylation of a specific proline and lysine, and you will find that on position Y, hydroxyproline and hydroxylysine, and this is post-translational modification. You will require vitamin C, regardless the details, but we will require vitamin C. So if you have a deficiency in vitamin C, you will have what's called the scurvy. The disease is scurvy or scorbut. This is called the scurvy. This is vitamin C deficiency, because you don't do what? You don't hydroxylate that collagen. So if you don't hydroxylate that collagen, what's the problem with that? Okay, for the normal, when you hydroxylate your proline and lysine that requires vitamin C, you can also glycosylate. You will add sugar, either glucose or galactose on OH, and this helps in formation of the pro-collagen or the triple helix formation, and this is more stronger. So when you secrete that outside the cell, it will be in that triple helix formation. This will be strong. So if you have that vitamin C deficiency, you will have weak collagen, so you will have weak blood vessel, you will have weak hair follicles, you will have bleeding pergams. Okay, and this is very pathognomonic for that. This is very important. You will have bleeding pergams, you will have abnormal hair follicles, and we will see that in details on nutrition section. Okay, so don't worry. Hydroxylation, synthesis, up till now, this is very right. Okay, and this is glycosylation. Glycosylation of pro-alpha chain hydroxylysine residue and formation of what? Of pro-collagen via hydrogen and disulfide bonds. What is that? Via hydrogen. To remember, you have OH and you have OH here. Oxygen and oxygen To understand this, just only to understand, not for the exam, but only to understand that you have that oxygen. It has more negative charge. It has more electronegativity. So it will pull, or it pulls electron around itself more than hydrogen, so it will be partially negatively charged. And for hydrogen here, it will be partially positive charge. So you will have a bond between these electrical signs, positive and negative partially, between oxygen and H, and this is hydrogen bond. So it will help in triple helix formation. This contains OH, this contains OH, and this contains OH, and sugar do the same thing. So it helps in triple helix streak of the free collagen alpha chain formation. Okay, if you have a problem in forming the triple helix, you will have that disease which is called Osteogenesis Imperfecta, and we will see that in details. So okay, if you have that problem with triple helix, you will have that Osteogenesis Imperfecta. Okay, associate that hydroxylation is here for vitamin C deficiency. Okay, that will cause scurvy, because hydroxylation needs that vitamin C. Regardless the details, the details are very, very, very sophisticated and is not required for the step. I want to understand that vitamin C with hydroxylation. Okay, and okay, associate triple helix with osteogenesis imperfecta. So it will go to the Golgi apparatus, and then exocytosis, exo out of the cell. This is exocytosis to the extracellular space. Okay. Here exocytosis of procollagen in the extracellular space. You will find that at N terminus and C terminus, many disulfide bond between the sulfur and sulfur, so it is called disulfide bond. If you want to understand what is the difference between N and C, we will see that in protein later, but I want you to know that N refers to nitrogen and C refers to carboxyl. Okay, this is terminus N and terminus C. We will see the details later, but you know that the terminus here N and this is C. Okay, and this is what called in a proteolytic processing. You will undergo what? Will undergo proteolysis. You will remove that and you will remove that. You will cleave them, the disulfide rich terminal region of the procollagen. It will make it insoluble tropocollagen. Here another name that's called the tropocollagen. It will be insoluble here in the extracellular. Okay, and it will go self-assembly. It will go self-assembly into collagen fibril. And then you will have assembly and you will have alignment. You will have assembly and you will have alignment. Okay, I want you to associate that proteolytic processing. Here, you will have a problem. If you have a problem with cleavage, you will have that disease which is called Ehlers-Danlos syndrome, and we will see that in details. Okay, we will see that on details. So associate hydroxylation. Associate triple helix formation, associate that proteolytic processing with their diseases. Okay, we have here collagen assembly and fibrils and a line for close linking. I want you to understand this is called the staggering. Okay, this is called the staggering. When you find that tropocollagen with that tropocollagen, they will meet in a point, and this is called the staggering. Okay, like a staggering ladder. Okay. For that collagen will be more tensile and more strong. And you have finally this assembled fiber or fibril. This is a small of fiber, so you will assemble both, or here you will cross link between them, and this will cause reinforcement of staggered tropocollagen molecule as I showed you here. And this is by covalent lysine and hydroxylysine cross-linking, and this between the lysine and hydroxylysine. Remember that lysine you will find that on position X, and hydroxylysine you'll find that on position Y. And what helps in that? It will be hydroxy vitamin C. Okay, when what is deficient, you will find what? You will find scurvy disease. Okay, vitamin C deficiency. This containing lysyl oxidase. Okay, this is an enzyme that will remove that hydrogen. Okay, this is oxidation. Okay, don't remember the details, but I want you to remember that this is lysyl oxidase, and lysyl oxidase needs copper for that. to associate that this hydroxylation needs iron. Okay, it needs iron. Okay, you can add it to your information. And here cross-linking needs copper. Okay, regarding the details are just sophisticated. Okay, but I want you to remember that to make collagen fibril, okay, it will cross-linking of the collagen and increase. Okay, okay, and this increases with age, and this increases with age. Cross-linking of collagen increases with age, because with age your production will be bad, so you will cross-link that, and we will see that again and again in just a few minutes. Okay, but keep in mind with me. Okay, so if you have a problems with cross-linking, you will have what's called Menkes disease, and I will show you Osteogenesis Imperfecta, Ehlers-Danlos, Menkes disease, so don't worry. And I will show Elastin, and I will show you Marfan Syndrome, Homocystinuria in that video, so keep in mind. Okay, you can take your breath and take that. Okay, do you remember that? Take your breath, la 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 la, just a break. La 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 la. Do you know that music? La 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 la. You know Godfather? Do you know Godfather? Do you know Marlon Brando? Do you know that? Do you remember that? La 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 la. Okay, just wasting my time to remove all of that. La 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 la. Okay, I want to add some information you will not find here, and I gathered it from the banks and add this to your book because they are important. You may encounter that in question bank, or you may encounter that on your test day. Okay, so keep in mind these valuable information. Okay, okay, with different color. Here, I want you, there is a measurement here in the lab. This is called hydroxylation assay, and this is for collagen quantification. Okay, you will find hydroxylation almostly in collagen only. So you want to quantify the collagen by this assay. It will be found in collagen. Okay. The technique that it will produce a chromophobe. Okay, it will produce that chromophobe, and okay, you can absorb that trace and you measure it. Don't memorize the technique, just remember that hydroxylation assay for quantification of collagen. Want to add another thing? Okay, I want to add another thing. Okay, what is that? Do you love potatoes? Do you like potatoes? Okay, do you like sweet potatoes? Or no? If you like sweet potatoes, I will make you don't like it for now, and I will make cross-linking don't like it. Okay, why? And I will make that enzyme don't like it. Because what? Because sweet potato contains what? It contains a molecule which is called beta amino propiononitrite, and this inhibits what? This inhibits lysyl oxidase. Okay, so when it will inhibit lysyl oxidase, it will make that collagen more, rather than it is stabilized and rather than it's strong, it will make it elastic. Okay, and it may affect the aorta, like in Marfan syndrome, and we will see Marfan syndrome. You will have the problem in the aorta, it will be elastic. Okay, to remember that sweet potato contains beta amino propiononitrite that will inhibit lysyl oxidase. Okay, this is very important. Okay, take a break. Here you can take a break. Okay, to remember, okay, to return back, you will have Osteogenesis Imperfecta. Here is Epiderms syndrome, and here we have Menkes disease. Okay, okay, okay. I want to associate that with collagen. To associate all of these diseases with collagen. With collagen. Okay. 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 One. Okay. Here we go. This is a genetic bone disorder, which is called a brittle bone disease. Why? Osteo here means bone, and genesis here means a formation, and imperfecta, it is not perfect, it's not as properly as it should be. So it's the disease called Osteogenesis Imperfecta. You have the genetic bone disorder. It's a brittle bone disease caused by a variety of gene defects, most commonly collagen 1A, collagen 1A2. What is that? You have that alpha 1, you have that alpha 2, and you have that alpha 3, and you will have gene here, and gene here. You will have alpha 1, alpha 2, and alpha 3, those the triple helix for the collagen. Okay, okay, you may have the gene defect in that or that or that. Okay, okay, and we will associate that with a word in genetics that's called what? That's called Lucas heterogeneity. Lucas heterogeneity, and we will see Lucas heterogeneity in genetics, that you have different loci. Here this is a chromosome, and here's another chromosome. Here is a loci, and here is a loci. You will find gene here, and you will find gene here. Remember that you will have chromosome 7, okay, and we'll have chromosome 17. Chromosome 17 will find alpha 1 and alpha 2, and chromosome 7 will find alpha 3. If you have a problem on a different locus, will give you that osteogenesis imperfecta. Or if you have a problem in alpha 1 or alpha 2 with that different locus on a chromosome 17, you will also have osteogenesis imperfecta. So this is called Lucas heterogeneity, that you have different heterogeneity, okay, in different locus or different loci. And we will see that again in genetics. Okay, so if you have a problem on that alpha 1 and these are healthy, so you will find that problem, and this is healthy and this is healthy, that the disease one will affect both or on another collagen molecules, and it will affect the whole collagen molecule. Okay, okay. So this is A1A, this is alpha A, and this is 1,2, this is alpha 2. Okay, okay. This is most common form. The most common form of it is autosomal dominance, that you need only one mutation from mama or dada to appear that disease, to show that disease on the new generation. Unlike autosomal recessive, that needs what? That needs the mutation of both gene from mama and dada, okay, on the both homolog chromosome. Okay, with decreased production of otherwise normal type 1 collagen, that you will find altered triple helix formation like that. You will find that this is have a mutation, and this is normal, and this is normal. Okay, this is normal, and this is normal. Okay, to know an information added, that you, if you have that glycine, didn't you ask why glycine? Didn't you ask yourself why glycine? I will show you. Do you remember that glycine is the smallest amino acid? Do you remember that glycine is the smallest amino acid? Yes, it's the smallest one, and this will fit for the 3 collagen molecules to meet each other like that. Like that, I will show you here with a different color. Okay, that color. You have that pro-collagen, you have that glycine, so they will meet here, and you have that glycine, so they will meet here, so they will meet like that, like that, like that. Okay, but if you have that one that has a mutation, and instead of glycine another bulky amino acid like that, so you can't fit that with that with another molecule, you can fit with another molecule. So it will be disrupted triple helix formation. And then you can conclude that triple helix formation will affect type 1 collagen, and this will decrease the production of otherwise normal or healthy collagen. If you have only a mutation in one or both of the three, so you will have osteogenesis imperfecta, because this one will affect both to join each other. So to remember osteogenesis imperfecta, here the problem with type 1. Do you remember type 1? Do you remember type 1? Where is it, type 1? Do you remember that bone? Do you remember skin? Remember tendon, dentine, and fascia, cornea, late wound repair? Do you remember all that? Remember the decrease in production of what? Of otherwise healthy will be affected in osteogenesis imperfecta? Do you need a triple helix? Do you need a triple helix? Do you need a glycosylation of pro-alpha chain, hydroxylation, formation of pro-collagen via hydrogen and disulfide? Do you need a triple helix formation? Do you associate that? Do you associate the information with each other? Okay. Okay. So you will have multiple fracture and bone deformities. Yes, like that. You will have that fracture here. You will have that fracture. You will have that fracture. Okay, you will have that fracture in that bone. You will have that fracture. You will have that fracture. You will have that fracture. They are multiple fracture. Okay, this is multiple trauma. This is after minimal trauma, you will have multiple fracture. Even during birth, because it is a genetic disorder, so during its formation of the baby, it has a very brittle bone. So, okay, so during, for example, vaginal delivery is getting outside from mama, in that very hard delivery, maybe with this trauma, you will have bone deformities. Okay, this is for the baby, or here for the child. This may be confused for child abuse. Okay, to associate child abuse. If you suspect child abuse, you can call here security persons, okay? And we will see that, we will see that just on suspicion. We will see that in medical ethics, okay? But you can be confused with the child abuse. Is it the trauma from the child abuse, or is it the trauma from the multiple fracture due to that brittle bone, and this brittle bone from what? From that type 1, and this type 1 from what? From the altered triple X formation. Okay, as I showed you. Here you have blue sclera. Okay, for that sclera, that contains that collagen. If this is defective, it will show you the choroidal veins, so it will appear blues. Okay, that you will have that sclera. Okay, you will have that choroid that contains the blood vessel, and then you have the retina. You will see that in details in CNS. Okay, so this is the choroid vein. So this is translucent. Okay, this is defective, so you will see the blue color. Okay, so this will be translucent connective tissue over the choroidal vein. So you will see blue sclera, and this is very important in the clinical vignette. Let me show you a child with 3 years old has multiple fracture and has a blue sclera, okay, and may ask you about the defective collagen. Okay. You will have subforms of tooth abnormality. Remember the dentine, lack of dentine will cause what? Will cause dentogenesis imperfecta, and this will include what? Opalescent teeth, that there will be discoloration of that. Instead of being white, it will have that color. This color. Okay, that previously. You will have conductive hearing loss. Why? Because you will have abnormal ossicles. What is the ossicles? These are the bone that will transmit that vibration from outside the ear. So they will transmit that wave, and a nerve will recept it. Okay, so you will have conductive hearing loss. Okay, you cannot conduct that mechanical wave through the bone because they are abnormal. Remember that the bone will hear this type 1. Okay, you will treat that with bisphosphonates. Why? To decrease fracture risk. Do you remember the mechanism of bisphosphonates? Do you remember bisphosphonates? Do you remember what's called osteoclasts? Do you remember they are derived from what? From monocytes, okay, like macrophages. Osteoclast crushes the bone. Okay, it will crush the bone. So I want to decrease the crushing of the bone because it's very brittle. I will give bisphosphonate to inhibit that osteoclast, to cause its apoptosis, and it will hit that, okay, to block the action of osteoclast on the bone. Okay, you will have bone multiple fracture. Patients can't bite. Okay, eye loss cleva, and teeth dental imperfections, and you will have what? Dentine, lack of dentine, and ear hearing loss. Okay, this is for osteogenesis imperfecta. Okay, this is for osteogenesis imperfecta. Remember that bisphosphonates inhibits what? Osteoclast resorption. Osteoclast resorption. Okay, okay, okay. I want you to know that osteogenesis imperfecta have many types. Type 1, and you will have type 2, and other types, but type 2 is fatal, and you may have what's called a stillbirth. The baby from very severe multiple trauma and very severe severe malformation or severe, you know, that bone of the chest, they don't form properly, so you have pulmonary hyperplasia, and then if you don't have that lung, you are not viable, you can't live, so you may have that stillbirth. Okay, this is very lethal. Okay, this is type 2. Okay, okay, okay. I want you to remember, autosomal dominance. You may have the defect in one chromosome, either from mama or dada, so you will have from one gamete, either from the sperm or from that ova. So to associate all of that, this is here the blue, bluish discoloration, this is a multiple fracture. Okay, for Ehlers-Danlos syndrome, also it has what's called locus heterogeneity. You have these, okay, different chromosome. So if you have the mutation here or the mutation here, okay, so you will have the same phenotype. So here is the disease, EDS, Ehlers-Danlos syndrome, and see that hyperextensible skin. Okay, you can extend it so much. This is hyperextensible skin. Here is faulty in collagen synthesis. Remember, you have a proteolytic processing problem. Okay, removing from N and S. Okay, to remove that. Okay, I want you to understand that Ehlers-Danlos syndrome itself also has many types. So you will find hyperextensible skin because the collagen is defective and it's found in the skin. Okay. And here is the classical type. You will find joint and skin symptom. Like here, you can do that. This is hypermobile joint, and this is hyperextensible skin, because you have that type 5 collagen, either collagen 5A1 alpha 1 or alpha 2. You will have a mutation here. The same concept. And this is the classical type. Here you have this abnormal skin. But why here you have hypermobile joint? Because here you have the bone, and here you have the bone, and here is what's called the ligament that attach both bones. This ligament is defective, so you can hypermobile this. You will have hypermobile of that bone. Okay, and you have tendency to bleed. Remember, we have vascular type. It will be fragile tissue, including vessels, like type 3 procollagen. So you will have the 3 mutation in that. This is the vascular one. And in the classical, for type 5 collagen, this is the joint and skin one. Okay, you will have hypermobility type, joint instability. This is the most common. This is the classical one. This is the most common. You have multiple types, as I said. Okay, inheritance and severity vary. It may be autosomal dominant or autosomal recessive. Okay, you may have that or you may have that. It may be associated with joint dislocation. It may have bari and aortic aneurysm. What is that and what is that, and what is organ rupture and what is uterus? Okay, to remember when you have that, okay, you have that blood vessel. Okay, this is the aorta. Okay, this is a blood vessel. If you have that defect in the collagen that support the aorta, so you may have a dilatation here from that, and this is called aneurysm. And we will see that in details on cardiovascular section. Or for perianeurysm, here it does blood circulation of the brain. Here this is what's called a circle of Willis. You will have anterior and you will have posterior, you will have anterior and you will have posterior, and they will meet each other. So you may have what's called the perianeurysm. Okay, you may have the same concept, this defective vessel wall, and you have this dilatation, and the dilatation may rupture and they bleed, and that's called the stroke. It will cause a stroke. Okay, and we will see that when it bleeds, again, associate that with Ehlers-Danlos syndrome. Okay, for perianeurysm, we will associate that with polycystic kidney disease, autosomal dominant. We will see that on CMC section, and I want you to know also aortic aneurysm to associate that with Marfan syndrome. I want you to study an association. If you don't master it, don't worry. When we reach that, we will understand it again and again and again, and we will associate the information. Okay, now for the uterus, I want to show you something. Here, the uterus. What is the function of the uterus for the female? Okay, for what? For formation of the baby. Okay, for formation of that baby. Okay, this is the uterus here. And this baby from one cell to cells to be an individual here increases in number of cells. Okay, so the uterus should be stretched, okay, for that developing embryo or that developing fetus. Okay, so you have that type 3 in what? In the uterus. Okay, if you have a mutation in type 3, so it will affect that uterus. And here see that from that lateral view, here that you have what's called the symphysis pubis, and here you have the sacral bone, and in between you have that uterus. So you will have hypertrophy of myometrium. Okay, it will expand and may rupture, and it will be gravid. It will be gravid uterus. Okay, it will be that it's very extending uterus on a very weak collagen. You will have that extending uterus, that gravid uterus on a very weak collagen. It may rupture. So you will have what's called a fragile tissue, and you will have organ are prone to rupture like that. You will have muscles, you will have the aorta. Okay, and this is for Ehlers-Danlos syndrome. Want you to know that vascular type is autosomal dominant. Okay, for the vascular type it will be autosomal dominant. Okay, see that for Menkes disease, you will see that boy, and remember it is a boy. Remember that boy, he's sad, he has Menkes disease. He is sad, he has Menkes disease. But this hair, okay, you know that you will have this spiky hair, funky hair. Okay, this is a brittle hair. You will see that this is funky hair. It's an X-linked recessive connective tissue disorder or the disease. X-linked. Remember that boys have X and Y and girls have X and X. Okay, for boys, for males, you only have X. So if X bears that mutation, it will appear on the boys. Okay, you will have impaired what? You will have impaired copper absorption and transportation due to defective what's called Menkes protein ATP7A. Remember that 7A absent copper versus ATP7B in Wilson disease. If you don't understand this, I will show you some concepts and we will see details. In the GI section. We will associate between Wilson disease. This is very high yield, and we associate between Menkes disease. Okay. For Menkes protein, that you will have that gene on X chromosome. This is a protein that will do what? That will hold copper. It will hold copper. Okay, so it causes its absorption from the GIT. It will cause its absorption. Normally, it will hold copper and transport it. And you need copper for what? Which enzyme? For which enzyme? You need it, yes, for lysyl oxidase. Okay, do you remember what was in the sweet potato that that inhibit lysyl oxidase? Is beta aminopropionitrile. Okay. So here, lysyl oxidase needs the copper for what? For collagen cross-linking between what? To make that fibrils to be a fiber between hydroxylysine and lysine. Okay, this is a covalent bond. Covalent bonds mean a real bond is a strong bond, unlike hydrogen bond between the hydroxyl group. Okay. So copper is necessary cofactor. Defective collagen results in brittle, kinky hair. It results in kinky hair. Okay, you will have that a problem in cross-linking. Okay. Decrease the activity of lysyl oxidase because copper is necessary cofactor. Okay, you have defective collagen what? Cross-linking. So you will have absent copper, you cannot absorb it, you cannot transport it. Unlike here, Wilson disease, it cannot secrete that, and we will see that it will accumulate in the liver, it will accumulate here in the eye, specifically at the outer rim of the cornea, and we will see that it will accumulate in the brain, and we will see that in GIT. So don't memorize that now. Just want you to know that it will result in brittle or kinky hair, and this is very pathognomonic for that disease, Menkes disease. It will cause growth and developmental delay. It will cause hypotonia and increase of cerebral aneurysm. Okay, see that again. You will have that floppy baby from that hypotonia. Okay, this is the head and this is the leg. Okay, he will be floppy. Okay, very floppy baby. Okay, and you will have what's called the bladder diverticula. Your renal bladder will have that sac. It's called bladder diverticula, and you will have tortuosity of the arteries. Okay, this malformation of the arteries, it will be tortuous. Okay, and you have cerebral degeneration from that, and you will have cerebral aneurysm dilatation. Okay. You may have hematuria. And add to your information that it will be on X chromosome. You will have that short and you have that long. It will be on Q, and it will be on 21.1. This information, this is not high yield, but add to your information. For early detection of Menkes disease, you will find HVA and VMA impaired ratio. Add that. They are enzymes, homovanillic acid and vanillyl mandelic acid. They are metabolites of catecholamine, and we will see that with a disease called pheochromocytoma. But also in Menkes disease, to early detect, find abnormality in HVA to VMA ratio. Okay, and this is for Menkes disease. See the last one in the video, elastin. Okay, lastly, let's see elastin. Okay, and see the difference between elastin and between collagen. Okay, and see the diseases that's associated to elastin. Here we have Marfan Syndrome, and here we have homocysteinuria, and we will have here a comparison between them. Okay, and we will end the topic of cellular part of biochem. Here, see that elastin, it gives you that "in" means a protein, and elastin gives you the sense of elasticity or the stretchy protein. Okay, you will find that within the skin, and you will find it within the lungs. You will find that within large arteries, like the aorta, one of the large arteries. Okay, and you will find that in elastic ligaments, like that in your back here. Okay. Okay, that enables you to bend your body. Okay, and you'll find that in your vocal cords that I use right now to explain this topic. Okay, and you'll find that in epiglottis. Okay, you will have that the tongue, and that you will have that epiglottis. Okay, and you'll see that function, the function of epiglottis in ENT section. Okay, here we have what's called ligamenta flava that connect vertebrae, and they will be relaxed and stretched conformation of that stretched protein. Here let's see that this is the form of relaxed, this is the relaxed form, and this is the stretched one. This is relaxed and this is stretch, like that, and this is a single elastin molecule that will be stretched here. Okay, okay, this is the stretching. Okay, this is the direction of stretching. So it will stretch that, and when you return it back, it will by elasticity, you will find that it will relax. Okay, okay, okay. To see the difference between them and between collagen, they are rich in non-hydroxylated proline, glycine, and lysine residue versus hydroxylated residues of collagen. If you want to understand the meaning of residue, it's that amino acid. Okay, this is amino acid, and we'll understand it in details in amino acid section. Okay. Do you remember? Do you remember that vitamin C, and you need ferric, and you need ferrous, you need Fe positive 2, and you need vitamin C for hydroxylation, okay, of proline and lysine. On which position? On Y position. Remember glycine, X and Y, that you will find in X the proline and lysine, and you will find in Y the hydroxyproline and hydroxylysine. Okay, okay, okay. To see that, you remember that we have tropocollagen. Here the name will be tropoelastin. Okay, it will be with fibrillary scaffolding protein. What does that mean? It means that there is a protein that's called fibrillin. Okay, that will attach to that tropoelastin. Here the fibrillin or fibrillin that will attach to elastin. Okay, that will be scaffolded. Okay, okay. This for the fibrillin and the tropoelastin. And here we will see, here we will associate the defect in fibrillin, that we will find that in Marfan syndrome on chromosome 15. We will see that in just a minute. Okay. We have that cross-linking occurs extracellularly via lysyl oxidase and gives elastin its elastic properties. Do you remember lysyl oxidase? Do you remember that it will have the cross-linking? Okay. Broken down by elastase, or the enzyme used to degrade that elastin, which is normally inhibited by alpha-1 antitrypsin. Okay, so if you have a decrease in alpha-1 antitrypsin, if you have what's called alpha-1 antitrypsin deficiency, you will not be able to inhibit elastase. And when you will not be able to inhibit elastase, elastase will work on elastin and will degrade it beyond the normal or beyond the physiology. So when you have alpha-1 antitrypsin deficiency, it will result in what? It results in unopposed elastase activity, which can cause what's called COPD, or chronic obstructive pulmonary disease. We will see that in details in GIT, and we will see that in details in respiratory. So, okay, we will see that in respiratory. Okay, I can understand this, but why we will see that in GIT? Because also alpha-1 antitrypsin deficiency, it will affect the liver. We will see the details in GIT and respiratory. Okay, so don't fear. But I want you to remember that here you have that the bronchi, you have that the bronchi, you have that bronchi, and then you have alveoli. Okay, when you get out the air outside your bronchi, it makes the bronchial wall to adhere to each other, that may block it during expiration. But because here bronchi, you have that elastin that gives you elastic recoil, it will prevent its collapse during the air getting outside. So if you have that damaged elastin in alpha-1 antitrypsin deficiency, for example, you will have that collapsed bronchiole, and you will have that trapped air here, and this is what we see in COPD, or chronic obstructive pulmonary disease. There is an obstruction of the air, you can't get it out of your lung. And we will compare that with a disease which is called restrictive pulmonary disease. So bear in mind to associate between alpha-1 antitrypsin deficiency and elastase, and especially one of the COPD here is what the disease which is called emphysema, or inflation, or hyperinflation. You have more and more and more air trapping or air trapped in your lung. Okay, we will see that on details on respiratory section. Okay, here we will see the last of our video, Marfan Syndrome, which is very high yield and very important, and homocystinuria, which is very high yield and very important, and you should be able to differentiate between them and associate the information with other topics and with other systems. Okay, so bear in mind, I want you to associate this with cardiovascular, I want to associate that with hematology, okay, and we will see that. Okay. Here with Marfan syndrome, it is autosomal dominant. Okay. Here is for Marfan syndrome, it is autosomal dominant, that you will bring that mutation to the new generation, and the new generation will bring that mutation to the new generation, and through families, and it will flow through families. So if you have the mutation in chromosome either from Baba, Dada, or Mama, okay, this is autosomal dominant. Unlike a disease called homocysteinuria, and we will understand this in details later, but let's take it for now to associate that with Marfan syndrome. Okay, it is autosomal recessive. This is from inheritance point of view of inheritance. For intellectuality, or for that you will be intellect. Okay, normally you will not be mentally retarded. Unlike for homocysteinuria, intellectuality will be decreased. Okay, on Marfan, this is normal, Marfan. Okay, while in homocysteinuria it will be decreased. Okay, see that. We will see what's called variable expression in genetics. I will show you that in details, variable expression, but I will tell you that you may have what? You may have varying disease severity, although this person have the same genotype defects, and this is a person and this is another person. They have the same genotype defects, okay, but the disease is more severe in patient B than in patient A. Although they have the same genotype defect, but this is what's called variable expression, and I will show you that in details when we reach genetics. Okay, don't worry about that. You have connective tissue disorder, okay, because it's elastin. Okay, so it will be in connective tissue disorder. It will affect the skeleton, it will affect the heart, and will affect the eye. We will see that. Okay, here FBN1 gene mutation on chromosome 15 here for Marfan syndrome, associate chromosome 15 with other diseases that's called Prader-Willi syndrome, and associate that Prader-Willi syndrome and Engelmann syndrome. We will see that, and we'll return back in genetics. We will see Prader-Willi syndrome and we will see Engelmann. Both have defect or a problem with that chromosome 15, and we will associate that with genetic imprinting. That okay, we will see methylation, and we will associate that through all the biochemistry section. Okay, when you finish all the biochem section, please associate these diseases together to be prepared for the exam, because the exam will ask you in that way. Okay, let's see that it's have some association with other topics. Okay, you see with different color. If you have that FBN1 gene will give what? It will give the fibrillin. So if you have a mutation, you will have a defective fibrillin, this is a glycoprotein. This is a protein that contains some sugar, okay, that form a sheath around the elastin and sequesters what? Sequesters TGF beta. It sequesters TGF beta. Okay, 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 and I will show you that in a second. Here, TGF beta is responsible for what? We will see that on pathology. So be prepared to associate that. I want you to associate TGF beta with that fibroblast and with that collagen, and we will associate that. We will associate that with pathology. Okay. Finding of that disease, it will be tall with long extremities. Here, this man will be tall with long extremities. To remember that Marfan, and this is habitus, is called Marfanoid habitus. Associate that with this disease we will see in endocrine, which is called MEN2B. Don't memorize it for now, but associate that. Remember, when you study endocrine, you will return back and see Marfan and Elastin again and revise it again and again and again. Okay, when you will have chest wall deformity, which is called here pectus carinatum. This is pigeon chest, or outside you will find the chest here near the sternum. It will find it outside, or inside like this. This is called pectus excavatum, and pectus means that chest. Okay, okay, okay. This is a patient, and this is very important to know that. Hypermobile joints, like what? Like Ehlers-Danlos syndrome. Long tapering fingers. You will find that they have a hyperelastic or hypermobile joints, and you'll find long fingers like that spider has long fingers, and the spider means arachne, so, and the dactyly means the fingers, so these fingers and toes means arachnodactyly. Okay, we'll have what's called cystic medial necrosis of the aorta, and you will have aortic root aneurysm, rupture or dissection, and this is most common cause of death. I will show you that in just a moment, and I will show mitral valve prolapse, and I will show you that when increased in spontaneous pneumothorax. I will show you that. Okay, okay, I will show you that. Here. See that, see that, see that. I will show you that in just a moment to understand the concept. Okay, for Marfan syndrome. For Marfan syndrome. Okay. Let's see that here that you have the aorta, you have what's called the intima. This is the layer near the blood, and what you have tunica intima here, and here is tunica media in the middle, and you have the tunica adventitia. Okay, for media you have the smooth muscle. Okay, okay, and here this is the wall is here. You need that elastin because it will be pulsatile, because you have a pump that pump the blood here, so it must be elastic. Okay, to get the blood and return back, and get the blood and return back, so you need elastin for its elasticity. Okay, so if you have defective fibrillin, so this defective fibrillin, it cannot form a sheath around the elastin. Okay, so you will have a defect in that, and you will have what's called the medial necrosis, cystic medial necrosis. In the tunica media, you will have defective elastin, and it will be replaced by what it's called glycosaminoglycan or ground substance. And this you will find that sugar, polysaccharide with few proteins. This is called the glycosaminoglycan, and we will see that again on cardiovascular system. So you have aortic root aneurysm. Here is the aorta, and you have dilatation in its root, so it will be apart from each other. This is dilatation, aortic root, so blood get back again into the ventricle, and this is what's called aortic regurgitation, and we will see that in details in cardiovascular section. You will have what's called mitral valve prolapse, because your mitral valve, okay, is defective. It may return back to that atrium, because of that disease fibrillin, and here the problem with elastin and fibrillin, so you will have mitral valve prolapse. You will have increased risk of a spontaneous pneumothorax. Why is that? I will show you that because these patients are so tall. They are so tall. Okay, see that. Okay, I will show you that in a moment. I will show you that in a moment. I will show you that in a moment. Here what we can see. Here we have that lung. Okay. And we have outside it, it's a pleura. Okay. So because they are very tall, this alveoli may rupture because they are tall and tall and tall. It makes it easy for alveoli at the periphery to rupture. When it ruptures, you will get that air trapped in the pleura, and when you find air in the pleura, this is called the pneumothorax. And we will see pneumothorax, this is high yield, but we will see that on respiratory section. So you will see that increased risk of spontaneous pneumothorax because they are very tall. Okay, okay. And we will see another association with pneumothorax, so keep in mind to associate the causes of pneumothorax with Marfan disease or Marfan syndrome. Okay. For homocystinuria, we will see that. We will see that. But before we see homocystinuria, I want to show you that here the lens, and here that we have that elastic protein. Okay, because they are defective, the lens of the eye may be dropped away, and this is called the ectopia lensa. It's not inside its proper position. Okay, this is called subluxation of the lens. Okay, this is what's called subluxation of the lens. Okay, I will show you that. I will show you that. I will show you that. This is very important. This is very important, and I will show you that in just a moment. Okay. Here we will see homocystinuria. We will see homocystinuria. Okay. Here. Okay, see, for homocystinuria, you will have what's called homocysteine, and if you don't understand this, we will associate that with amino acid cysteine, and you will see that in details that here cysteine contains that sulfahydryl. Homocysteine, okay, there is a difference between just only number of carbon between them, so you can, from homocysteine, you can synthesize cysteine. Okay, and we'll associate that with methionine. We will see that in details, but just for now, to know that homocysteine is due to cystathionine synthase deficiency. Cystathionine is the intermediate between homocysteine and between cysteine. If you don't understand this, okay, don't worry. I will show you that again and again and again in our biochem sections. Okay, it will lead, if you have a problem in cystathionine synthase, you can synthesize cystathionine, so you will build up what? You will build up that homocysteine, and you will have homocysteine built up. Its presentation is similar to Marfan syndrome, with that pictus deformity like that, and it will have stall stature. Okay, but you will have increase in arm to height ratio. You will have that. You have high increase in arm to height ratio. Okay, and you will have decreased upper to lower body. You will find that upper body like that and lower body like that. Just I will extend that for illustration. Okay, this is upper to lower body. Okay, you will have arachnodactyly. Okay, and you will have joint hyperlaxity, and you will have skin hyperelasticity, and you will have scoliosis. Your vertebral column will be bended like that. This, for simplicity, this is scoliosis. Okay, this is autosomal recessive disease. Intellectuality will be decreased, and vascular complication, you will have thrombosis. Okay, and we will associate that when we see homocystinuria in details. For lens dislocation, this is very important to differentiate between them. Okay, we may ask you, they may give you homocystinuria and diagnosis of homocystinuria, and they ask you, is the lens dislocation is upward or temporal, or upward or medial, or downward or nasal, or downward or medial, or what is that? I will show you that in a moment. Okay, you have this nose. Okay, you have the nose, and here you have the ear. This is the temple or the temporal side. Okay, and this is medial one, this is the lateral, and this is the medial to the eye. This is called the nasal side. So here you have the lens. If the lens goes in that diagonal or goes in that diagonal, if it goes upwards and temporal, this is Marfan, and remember Marfan fans out upward and temporal. But for lens dislocation of homocystinuria, you will have it downward and nasal. And to remember, when you go to home, you are going to near the midline. This is a mnemonic to remember, that's the midline to home, to remember homocystinuria. They're going down, okay, in that diagonal line. Okay, remember that your home or your house is downward. Okay, okay, to be a shelter right from the rain. Okay, anything. Okay, I want to show you just two information to end the video. Okay, one about here, one about Marfan, and one about phospholipid membrane. I will show you right now. Okay, I will show you a thing that you may find in New World QBank. I will show you a thing that you may find in New World QBank. Here, it changes with aging, with you getting older and older and older. Here you have in the skin what's called epiderms, and we will see that in dermatology, and beneath it you will find the derms, and the derms contains the connective tissue that will contain the collagen and elastin and these fibers of fibric protein. Okay, to see that changes, you will have decrease in dermal collagen and elastin. It will decrease, you will have decreases in synthesis, okay, of collagen fibrils, okay, but cross-linking will be normal or may increase. Okay, to remember cross-linking, they will be intact, but the synthesis itself will be decreased. And I showed you that here, remember, cross-linking increases with age, but synthesis will decrease. Okay, as I told you. Okay, I want to show you again, okay, the proper information about that I told you in last videos. Where is it for the phospholipid membrane? For the phospholipid membrane, that to remember the apoptosis signal, you will find that serine comes outside. This is called eat me sign. It tells the macrophage, not the lymphocyte. Okay, to correct, it tells the macrophage to do what? To phagocytosis to that apoptotic cell. And we will understand apoptosis on pathology. And this for the cellular part of biochemistry. The next section we will see laboratory techniques. Okay, study hard, solve on that topics from your world, from RX, okay, and see another banks, but your world is the most important one. You should solve it, solve the biochem after you end your videos. Okay, thanks.